are to be laid out and organized so that they are clear to the reader. What you see in the case note and how you express it in your letter, this is important to study. Here these images tell us about certain events, procedures, and progress. Like an elderly patient had a fall. She was then brought to the hospital via an ambulance. Several investigations were conducted. She underwent surgery. Post-surgery, her vital signs are within the normal limits. She was then seen by the hospital physiotherapist. Intravenous were removed. She is now able to mobilize from wheel to frame. She is now being discharged to rehabilitation. Such kind of image, when it is formed in your mind, you understand the case note clearly, and this is required to understand how you're connected to the patient and give an appropriate approach. Thereby we can convey the things like hospital events or anything which is required for our writing task with proper phrases and order. The information in the case notes are presented in note forms, and they are to be transformed into sentences with a formal language, which means you should sound professional. Like here it says, worsening left-sided hip pain over an 18-month period, limited function and mobility. The patient underwent left total hip replacement. You can write this as she underwent a left total hip replacement due to significant functional disability and worsening pain. We know how important parts of speech are while transforming the case notes, like subject, verb, object, connectors. 2013, hypothyroidism, copimazole. You can write this as, in 2013, she was diagnosed with hypothyroidism, for which she was prescribed copimazole. I have used passive voice here, like she was diagnosed, she was prescribed. Or else we can write like this, she was prescribed with copimazole to treat hypothyroidism, which was diagnosed in 2013. Now, if the medication is not important for the reader to know, but about that she had a treatment for hypothyroidism in 2013, we may write it like this, she was treated for hypothyroidism in 2013. So you have your own ways to put information on the paper. She has been monitoring her blood pressure and sugar levels at home since the diagnosis of type 2 diabetes. Maybe the reader is familiar with the patient, or the reader knows about the diagnosis, then it is not important, or we can just avoid writing when it was diagnosed. On the other hand, if it's not aware of the diagnosis, then we may be required to write when it was diagnosed. She was diagnosed with type 2 diabetes in 1999. She has been monitoring her blood pressure and sugar levels at home since the diagnosis. You have to make sure that you give clear explanation of the information you have been given in the case note. Keep your reader at the center of your thinking. You need to make decision of how to structure your paragraphs, how to structure your letter based on what the reader would consider